Let's get oral.
Hey, it's Camille back at Let's Get Oral. And today I'm so excited to introduce Dr. Maria Sokolina, who I actually happened to meet in Reno at the AAOSH event, Collaboration Cures. And she piqued my interest because she addresses sleep apnea. She's a dentist by training with a specialist in sleep medicine. And I'm intrigued after our previous episodes in this space.
Let's get oral.
Of really getting the lay of the land to treat our sleep issues because we're starting to realize that we probably all have one. So welcome today to Let's Get Oral, Dr. Sokolina. Hi.
Good afternoon. I'm so happy to be here, and I'm so passionate about scientific work you do and addition to podcast Let's Get Oral.
Thank you. Well, I really wanted to kind of dig into your background just to get the lay of the land, how you came into be interested in dental medicine for one, but then how you bridged into sleep medicine as a specialty.
Very common question I get asked a lot. How do you become a dentist? Actually, since I have an accent, I'm going to disclose I'm from St. Petersburg, Russia. So I choose to be a dentist at age 16. We have to make that choice quite early. And logic behind that, I really like to help people. I'm so passionate about medicine. My grandma was a doctor, and she was in the World War II. She was practicing during that time. So that was always in the back of my mind. And they named me after her, Maria. So, and we have a father name. So her father was Isaac, just like mine. So we have a same name. And I thought kind of I should repeat her destiny. And I'm passionate about human body. Like nothing more interests me than processes, what happen in a human body. I've been practicing for a very long time, and I did not lose the curiosity. I'm still listening to the book about medicine and about doctors, so I love it. Second thing, I really want to be in charge of my business. That time in Russia, we didn't have ability to have businesses. But even on this little scale, I want to be in charge of my operations. I want to have my ideas, and I want to follow my direction. So I want to be a little bit independent. When you practice general medicine, you have a collaborative team. Now I do too. But that time I thought I'm going to be just a dentist and I can do my own business. So that was the question why I become a dentist. And I'm going back to my first medical school. We learned so much about general medicine, which was so great for me because I was so passionate about that. So I have a lot of medical knowledge. I can, deliver the baby and treat other things.
Wow.
But that's how education in Russia kind of not very narrow. So then I moved to United States and I graduated from NYU Dental School. And then I did a GP residency. And I have a passion for beauty. I'm a very aesthetic person and I like everything beautiful. So I thought what I want to become an orthodontist. But luckily to me, I was not taken on the program. I spent 2 years trying to apply to the program, but I was not chosen, which happened to be a good thing. I always try to look at life as a life lead me through the silver linings. And sometimes I don't think I need it, but that happened to be.
Oh, I relate to that very much. Yes.
So I didn't get to the ortho, and I was looking, what am I going to do? What is going to be my big passion? So I took a lot of courses on cosmetics. I want to do full mouth rehabilitations, and I took a lot of advanced courses. We have Dawson Academies, Pancake. So I love to learn. That was so fascinating, but I had a huge fear inside of me. It's like I had like a big bug inside of my stomach. What's going to happen if I'm going to do full mouth rehabilitation or just, anterior reconstruction, beautiful smile, and they're going to break it. And a lot of people are bruxers. They can easily break my stuff. So, those courses, I'm going to use best materials. They're not going to break it. Guess what? They will break it. They will break it. So then I got back to my original passion called ortho. I thought I'm going to reposition the teeth. I'm going to make them in the right position, just like Dr. Dawson taught me on the course. It's going to be dots in the back. So teeth just going to contact with the dots. and lines in the front. So the front teeth going to protect back teeth. I'm going to position that way, and I'm going to restore them that way. Then that's going to be failure-proof system. Guess what? No, it's not. It's not.
Oh my
And then,
gosh.
and then on a course, I learned there is a condition called sleep apnea, and we are designed to breathe. We might think we designed to study, we designed to laugh, we designed to eat. I don't know, a lot of passions in life, but no, we actually are destined to breathe. And that's our major topic in life. And if we cannot breathe, we're going to do whatever we can to breathe,
Yeah.
including breaking the teeth.
Yes.
Nobody going to care about my fear of failure. They still going to breathe. Breaking the restorations doesn't matter. So that way, of course, I knew about night guards, but on that course, I was presented a lot of research what the guards, what they taught me in the dental school, actually can make sleep and breathing disorders worse. So I was thinking, I'm going to do something beautiful, but actually make the health worse. I'm going to make them stop during the night more times with my night guard. So I didn't like that idea either.
Yeah.
And, oral appliance, that time I thought would be nonsense. I thought, okay, I'm going to do my beautiful ortho. I still love aesthetics, didn't change. I'm going to do the restoration. And then I'm going to put the guard, sleep appliance, and then they're going to breathe. But science is not a closed book. When I become
Yes.
passionate about sleep, I learn a lot of other techniques, which I incorporate in my practice. I do orthodontics with oral appliances, making the space for the time bigger. I'm very passionate about the nose. I teach people how to breathe with the nose using the help of myofunctional therapy. So I teach them how to breathe through the nose. I'm trying to make the lips stronger. We call it face yoga, let's say. And make a tongue stay on the roof of the mouth and swallow just with the tongue. What in my mind, at this moment of my science development, my level of understanding, I'm creating healthier airways. So that's a broad strokes of my story.
Wow, that's quite the journey. I have to say that when you decided on dental medicine, you said it was just dentist. You're just going to be a dentist. But I see your journey into sleep medicine as kind of addressing a full body health experience through dental medicine. So that's, I think, an interesting way that you've come to kind of restore a healthy body as well.
Yeah, that's why I'm
Really
very
getting back
passionate.
to your grandmother's roots.
Yes, very passionate about your product because that's addressing systemic health through oral health and
Yes.
danger of periodontal disease, or
Yes.
I would say periodontal disease very often stand on my way. Also adding to that fear, to that big bug,
Yes.
of fear. I'm passionate about that. I like how you, through the mouth, trying to send the message to the whole body, which I think on a lot of levels, we must do. And I see that connection on everyday practice very often. I don't know how familiar your audience with the fact what we use our teeth for balance. And it's a broad spectrum. We can say balance, through periodontal disease and, gut health. We can also say balance. We're trying to orient ourselves in a space with the teeth.
Mm.
We are creatures who use 2 feet, very rare in, we can say in the universe of species. Not that many species just walk on 2 feet. A lot of them use 4. We use 2, and we need to kind of check if we're standing right. If our body is not symmetrical, we have a liver on the right side, heart on the left side. So we have to constantly balance in space. We use our teeth.
I didn't realize that teeth were part of balance. Tell me more.
Oh yeah, teeth are big part of balance. I do a lot of work with the physical therapists, especially people who graduate from Postural Restoration Institute,
Wow.
and they help to restore health. I would say fascial health or joint health or spine health. It can be on a different level because a lot of people a lot of people in this society, in this evolutionary space, have a forward head posture.
Yes.
So with that, they have a lot of pain in the neck and the shoulders, temporomandibular joint, one of it. But very often we notice they have pain in the feet, in the knees, in the hip, and a lower back pain. And physical therapists, doing certain manipulations to create, yes, balance, but also tension-free environment. And they need the teeth to come together in a certain way. It has to be bilateral, because if it's not bilateral, it's going to affect the gait. It's going to affect how people walk. So
Wow.
I make the guards in a specific design according to physical therapist requirement. And then with that guard, person wear it 24/7, and it change a lot of parameters. And then we have to meet again, and I have to readjust because body is not so steady, body adjusting itself. So I have to adjust. And this is proof. I see people, I have a lot of cases, and they say, I feel grounded. I can feel the earth,
Wow.
the surface under my heel with the guard. And without guard, I only feel the front portion of the feet.
Wow. So the guard is helping them align their body from top to bottom, is what you're saying.
From top to bottom. It's
Wow.
absolutely, for me, it still sounds like magical.
Yeah.
It's still like I don't fully believe it, but
Right.
I've witnessed it many times. And in this particular philosophy, it's absolutely real.
Wow, that's incredible.
So,
Well, I was going to ask, kind of try to get at what the patient journey looks like. Like, how do these people find you? How do they identify that they need somebody like you? What's kind of their background experience that allows them to find this realignment?
the realignment is a different part of the story. Realignment more related to physical therapy. But we're talking about standard story. And in my practice, I help people from two different sources. Of course, my team is helping me to identify patients in the office. And for your listeners, for dental hygienists or for dentists or for people, my functional therapists, I don't know who on that wonderful journey, people always have a lot to offer, to show what they do have a sleep disorder breathing. I really like, she was a guest on I also have a channel on a Facebook and YouTube and LinkedIn called Sleep Apnea, Snoring, Breathing Health. And I learned so much from my guests. So from Lauren Gates, I learned the system called NEST. And that's what I use to identify people in my practice. It
Nest.
can be narrow arches, enlarged tonsils and adenoids, long soft palate, tether oral tissues. We're talking about, a lot of people have a growth of bone underneath the tongue and
Yes.
sometimes in the middle of the palate, and sometimes they have a buttressing on a tapped jaw as well on a cheek side. Uh, those are the signs of pressure we exert on a bone when we clench and move the jaw forward during the night when we cannot breathe, and during the day when we need to balance. So, and scallop tongue, that's the last one, S. So if patients who come to me have signs of nest, what I just described, and then I look at the nose. If they have a very thick side of the noses called ala, that's a sign for me that they might not be using the nose all the time. So I ask them about
Oh,
mouth breathing. And the mouth breathing, just like we talk about microbiome and the
yes.
ortho product can help us, mouth breathing has a very specific clinical picture with inflamed gum, usually in the front. For some reason, the posterior teeth, they still get wet, I guess, with the cheek help, whatever. They don't look so inflamed, usually in my experience. But the anterior gum can be bluish, usually have a lot of tartar and a lot of plaque in the front area. So if I identify signs of mouth breathing, we start slowly interviewing the patient, because I notice if I start very actively advise our level of information in the general population is not to that level what dentists have to talk about sleep disorder breathing, even though with my writing for high-profile publications such as AARP, I try to change it. I try to publish the article to educate general public what dentists see so much. So we try to offer patients to use the application called SnoreLab, so they can listen how they snore at night. Maybe that can be a good idea. And if we have attention, let's say if somebody also concerned and we show the signs and we connect it with the medical history and high blood pressure and sometimes atrial fibrillation and multiple medications, what physicians prescribe, if one blood pressure medication doesn't work, another blood pressure medication doesn't work. So, and same thing with atrial fibrillation. And very often it's a diabetes, an allergy, and acid reflux. So it's usually a bouquet. That being said, we convince them to visit a sleep doctor and get a sleep study. And then we schedule another meeting to discuss the findings. Of course, they discuss it with a sleep doctor, but we also try to help them on the journey. So this is one source of people what we help.
Right. So you're basically kind of doing a slow interview process with your patients just to root out any potential sleep conditions, and then a slow convincing that all of their pathologies might be related to a sleep issue. That's quite a journey and a convincing.
Yeah,
What's
but
what's your other pathway of patient?
Yeah, no, I want to share one thing what I actually learned not yesterday, but yesterday it was a little bit shocking to me because it's related to my father's story. I visit a wonderful retina special yesterday because my sleep apnea patients wants to connect us. This retina specialist, his name is Dr. Patrick Higgins. He treats a very special condition in the eye. It's called thrombosis, vein thrombosis in the eye. So all of a sudden, the symptom is patient would lose partial vision in the eye, maybe not a whole view, but certain point. That means what in this part of the eye, the vessel become blocked. So this called thrombosis. It can be central vein thrombosis or branch thrombosis. So this doctor made the research, and there is a direct correlation between sleep apnea and vein thrombosis.
Wow. Why is that, do you think?
I think it's a similar mechanism as people get stroke and heart attack. People who have a sleep apnea, they have a higher chance of getting stroke and heart attack. But maybe it's a different mechanism. As of now, we met in person. I visit his office to learn more about this phenomena. It's not so wide known, but he find a direct correlation. What remind me is story of my father. My father lost left eye, so left one eye totally lost the vision.
Wow.
And no nutrition, nerve die, no eye, just one eye, and nobody thought about sleep apnea, even though my father is mouth breather. And, it took me many years to convince my father to get a sleep study. And only my father got a sleep study when he doesn't snore. He just breathes with the mouth. He doesn't snore. He got Parkinson's disease. And that was a very serious argument for my father to get a sleep study. And my father got a sleep study, and he has a severe sleep apnea. And his heart rate on that sleep study reached 200 beats a minute, which was shocking to me. Yes, it's arrhythmia, all of it true. So it happened, with me.
Wow.
It happened in my home. And now my father has a treatment for sleep apnea. And honestly, truly, he didn't get vision back, but his Parkinson got better.
Wow, that's incredible.
So this is a very powerful story for your listeners about central vein thrombosis, which is totally not related to sleep and breathing, right? We don't look in the eye as a dentist. An internal medicine doctor also don't look at the eye, and it's not possible to see what I learned from Dr. Patrick Higgins, but it's possible it's a very strong correlation. Vision is very precious luxury to have.
Yeah, right. My gosh, that's illuminating. Do you think that with all of the wearable devices that we are able to do at least kind of a home evaluation for these sleep issues, or do you think all of the devices that we have in market aren't quite sufficient and that a true sleep study is really needed for most?
My answer is I would believe a true sleep study, but I'm so passionate about wearable devices.
Yeah.
I like when my patients use wearable devices because there are so many of them on the market. A little bit hard for me to have one streamline what I should see as a treating doctor on the data. But I have a lot of hope for wearable devices. I read what Apple gonna issue the device what's gonna detect apnea. My patients use the ring what
Yeah.
actually show apnea hypopnea index.
Yes.
I don't know if it's 100% true or not 100% true, but what I love about that was it bring attention to sleep issue. Of course, opposite side of the coin, it's increased the anxiety, which is true. But I think it's important to establish habits with the wearable devices,
Yeah.
time you go to bed, time you wake up, and bring attention to the topic. So for me, I highly believe in the technology, and I think my answer to you, I think this is great. Just I did not develop a protocol, exact protocol, how to monitor my treatment. Like let me put it this way, except that ring,
Right.
which I use for people who
Yeah.
bought
I
it.
like the ring too.
Yes, and it's not Aura ring; it's a different ring.
Okay. Which
But
one?
I don't come up with the name. But this ring, they can Google it. Ring what detect AHI, apnea hypopnea index. It's made probably with same idea as the Aura ring, but it's just a different company. I always,
Okay.
just name doesn't come up. I apologize, but I
Yeah.
know it costs $80 or $90. So that I know. I just don't remember the name.
Well, I think even the Aura Ring might give you an indication with movement and pulse ox and heart rate throughout
Yes.
the night. But I love that they're doing an apnea. Do you know what measure is different or how they're combining the data for that output?
Uh, that I don't have such a
Yeah.
deep knowledge on that. But one thing, what I want to tell about oxygen, unfortunately, Aura Ring measure oxygen only every 15 minutes.
Yes.
When you have a sleep study, its
Yeah.
data is more accurate, it's more often.
Yeah.
To have a desaturation for that long, not to get medium number, it's a little bit different story.
Yeah.
That's why at this stage of science development, I would recommend sleep study. But sleep study, what we use, it's also a ring or it can be the bracelet. So it's not intrusive. For a lot of people, they are scared
Yeah.
for sleep study going to be intrusive and they not going to be able to sleep. But no, it's just a ring, it's just, piece on a finger and you be able to sleep and change the
Yes.
position and, do what you need. You can attach that ring with a little, tape and
Right.
that's it. And you're going
Yeah.
to have a wonderful night.
So you can still go home or is it in the
Go
facility?
home. No, no, no,
Yes.
no, no. Those are
Yes.
in the beginning. I always for me personally, I'm a very delicate sleeper. So, sleep routine is something so precious for me.
Yes.
Um,
Same.
I love when people do it in a sleep lab and, I visit a lot of sleep lab and I spend a lot of nights in the sleep lab myself. Uh, but for a lot of people, just to sleep in the other territory can be already no sleep.
Yes.
Um, and if somebody can do it for me, that's the best because I can talk about REM, I can talk about deep sleep, I can have so many parameters with the position and include positional therapy into my treatment armamentarium. But in the beginning, I would be fine with the home sleep study.
So, when the patient is finally ready to be treated, you mentioned guards. I know that guards have changed over the last few years pretty significantly. Can you tell us about how you fit somebody for a guard and what their sleep looks like afterwards?
The guards,
Yes.
we call them mandibular advancement device. And there are 126 designs on the market. There are two types. One is tongue, it's a tongue positioning device, which I don't have a lot of luck with them. For some reason, my patients don't like to have a tongue fitted in a little, even soft device. So I don't use them much. I had experience with them and not in my hands. And then other devices would move lower jaw forward, mandibular advancement devices. And they can be made from acrylic and they can be 3D printed. And the material, can be different. Yes, there is evolution with digital scanning and 3D printing in this industry. A device can be much thinner. And, in my mind, I have a very simple way of selecting. I help a lot of people with Medicare, and Medicare dictate the design of the appliance I have to use. So I use herbs and top, but I use just herbs for Medicare patients. And then a lot of patients have temporomandibular jaw issue, which is so closely related to sleep apnea, like I mentioned in the beginning of my story. Then for people who are very sensitive, I use device and can call differently from different companies, but I call it dorsal. It has a screw, and with a very tiny advancement, I would say, fool the muscles or fool the joint, or I can be so gentle in that process to advance the lower jaw forward. Because the main principle, what I use when I design my appliances, but patient has to become friends with oral appliance.
Yes.
First of all, patient has to be comfortable. That's number one.
Yeah.
Then we get to the briefing point if patient does not have aversion to my creation. And there are appliances what are 3D printed without any mechanism. I'm changing the trace. I like the sleek design of them. They can be very thin, just like a clear aligner. Thin. I use from lab called Sirena.
Okay.
When I advance, that's half of a millimeter, which doesn't seem like a lot, but it can be a lot for the muscles. So I use it for people who I can, jump half of a millimeter. So I use those appliances a lot, and they are white. They are not visible. People can change position, and they can stay with the mouth closed.
Nice.
Which is very important. Those are regarding the device, but just to give a little preview, I don't only treat the mouth, I pay a lot of attention to the nose.
And you're located here in New Jersey as well as New York?
Yes, I have two locations in New Jersey and in New York City.
And you work with providers all over the city as well as New Jersey to kind of collaborate?
New Jersey, yes. That's the thing what I was thinking when I was selecting the field, what I'm going to be independent, but happened to be not true. I have a wonderful crew of health professionals who I work with. This is actually other group of my patients who come to me by referral. I get referrals from medical providers. And those relationships are very, very special because a lot of medical providers are not ready to collaborate with the dentist.
Right.
We are totally different tribe. Maybe we're a little bit monsters too. I know it's a Halloween and it's appropriate word in this time of the year, but usually dentists portrayed in the media as, I don't know, I know the dentist from Jerry Seinfeld, or my favorite is, I forgot his name, but Steve Martin, I'll be dentist, that song from Little Shop of Horrors.
Yes.
So that's
Yes.
another portrait of the dentist,
That's
which
amazing.
is wonderful, which creates wonderful preview for people before coming to dental office, as well as for medical professionals. There is a stigma about that, and I'm trying to break that stigma.
No, we all are. Yeah, I can't wait to merge the two categories at some point. I think that some of it is going there. We'll see. We'll see. We'll see how it all comes out. So, have we sufficiently walked back from the actual oxygen devices being kind of liberally handed out for sleep apnea?
Oh, you're talking about CPAP machine?
Yeah.
No, they're still golden standard. And even among my, collaborating physicians, they are first line of treatment. They don't offer people oral appliance. Some of them do. Some of them do. If dentists develop trustful relationship with the physician might recommend oral appliance as a first line of treatment for sleep apnea. But most of the time, people have to get through CPAP machine, which is a wonderful treatment. It's just maybe difficult to get used to.
Yeah.
And there is a whole care protocol that you have to follow with the cleaning
Yeah.
and drying, to prevent actually microbiome of a
Yes.
CPAP machine from growing.
Yes.
It's a very important component, but there are some structures. But for people who have both conditions, insomnia and sleep apnea, CPAP machine is a very difficult battle.
Yeah.
That's why oral appliance would be a little bit, easier street and avenue. And of course, in the present state of us as a human species, 25%, according to statistics, have a sleep apnea. That means from 10 people who come to dental office, 2.5 have sleep apnea or sleep and breathing disorders. And medical professionals, it's the same statistics. And as a nation or as a population, we have to do something about our education or acceptance. And I'm lucky as a dentist what I can see the science, what this statistic is true. And I do see it.
I mean, you're doing your best. You have a podcast and you
Yes, I have a
trying to
podcast.
teach. And,
Yes.
Going to all the right conferences.
Yes, to meet the scientists like you. Yes.
Yeah.
Yes, I'm trying to create bridges. I think with the bridges, we can build a healthier society.
Yeah. So when you see patients that need interventions, what are their main complaints? You mentioned kind of backing up with the gentle, long, enduring conversation with your dental patients in trying to help them see the connections between their less obvious pathologies. So you've mentioned heart disease as being correlated to sleep disorder. What other things are kind of signs that we should all be paying attention to for sleep disorder awareness?
As common as it sounds, allergies.
Yeah.
Allergies. That, and I usually look at the nose and the shape of the nose, and it has a very specific shape of thickening on a side, and a second very specific component when a person breathes in, the nose kind of close, very strong valve.
Oh.
I don't know if it's related to allergy or not, because a lot of people who I see, they do have allergy. So I noticed a very strong nasal valve would close the nose and make airway collapse. But allergy, very common component. Second, very common component called acid reflux.
Oh.
What I learned from my scientific research, a lot of kids in a young age, they have a damage or danger for asthma, and medication albuterol would actually help people breathe. Also help acid to get out of the stomach. That's why it's such a direct correlation. Almost like I see people on the screen. My first consultation usually through telemedicine for somebody to feel comfortable with me, and story after story is the same. I cannot get out of bed. I don't feel refreshed in the morning. I feel so tired in the afternoon. I drink 1, 2, 3, 4 cups of coffee to stay awake. I fall asleep with any possible opportunity, but when I sleep, I wake up that many times. I don't know, 2, 3, 4 times, whatever people remember. So I'm not answering your question directly, but
No,
it's not a disease.
yes, this is exactly what I was hoping for. Yeah, so
Yes.
okay, so allergy, exposure to albuterol, probably, and uh, yeah, the not feeling awake ever and really just struggling through every day. So, on
Mm-hmm.
the other side of sleep disorder, once you've kind of addressed the main problem and they're feeling better, what are some surprising indications that they've come to you with where I mean, balance is one that I hadn't thought about.
Mm-hmm.
So, kind of in that same vein, what are some surprising ahas that your patients have gotten from curing or treating their disorders?
Since I mentioned to you, treating sleep disorder with oral appliance, I call it a bandage. So
Yeah.
I have to put a bandage on a wound, but you can feel yourself, but you can function through the day. You can reunite in a bedroom. I think that's a very, very important component. What
Yeah.
you can enjoy yourself in a bedroom, not to sleep somewhere in the basement on a sofa, nobody knows where, but you can sleep in your own bed with your loved one. I think that's
Mm.
very strong. Uh,
Yeah.
the surprising element, what I always suggest to people, I'm going to give you this bandage. It's going to be the oral appliance, and you can, enjoy yourself. But do you really want to be married to my oral appliance for the rest of your life? Or combine my oral appliance with a CPAP machine? Or you want to make some steps towards the cure?
Yeah.
And different people at this stage of science development looking at the cure with a different eyes. But for me, I find wrong function of the tongue and wrong breathing. I see it on every single case. People don't realize what tongue have to be strong. Tongue is a very delicate, important organ, like a rotor of the spine. It has to be strong, and it has to stay on the roof of the mouth to
Yeah.
support temporomandibular joint as well as the spine, as well as stimulate the vagus nerve, which is responsible for parasympathetic nervous system. I'm talking about significant increase of anxiety in our society. So I always try to convince people into self-help because I believe you're your own best doctor. So we offer them myofunctional therapy to make a tongue stronger, lips together, breathing through the nose. And medical doctors are very skeptical about this treatment because it takes 6 to 8 months for people to get trained. But I think even if you cannot address sleep apnea fully, and if you're able to breathe how you should breathe through the nose and keep the mouth closed, which is actually great for systemic inflammation, you're already doing yourself a huge favor. Yes,
Yes.
I know the term immature swallowing when people have a difficulties to keep the tongue on the roof of the mouth. Yes, sometimes the shape of the palate is not so flat for the tongue to stay there. But I'm type of a person who believe in the natural ability of the body to heal themselves. So at this stage, I'm still very excited about face yoga or physical therapy for the muscles of the nose, lips, and tongue.
Do you think that patients that have gone through your program and come out truly changed, do you think that having them speak to their, I don't new life, if you will, is a compelling way to grab the attention of both the medical communities and the potential new patients out there in the world?
I highly believe into that. That's why I interview a lot of people who agree to share their success story with the audience, and they explain how it worked for them or what didn't work for them or
Right.
what they would change. This way, from the first-hand experience, listeners or my audience be able to see what exactly is
Yeah.
myofunctional therapy and how does it work. But in the same time, we want results yesterday. So if you
Yeah.
want results immediately, immediate gratification, maybe this particular program is not for you. That's true. But in the same time, if you think about pill is great, may give you immediate gratification as well as a side effect. And albuterol is a great example of
Yeah.
that. In the same time, I know you're very curious about surgery. Surgery is great. Some surgeries I don't support. I believe what function define the form. So before you want to create a different form, you need to prepare function and then continue with that function. So if your listeners thinking about correcting deviated septum, very important to be able to breathe through the nose before the surgery, what you can utilize your very straight line as a line, not deviated septum anymore, and breathe through the nose. If you think about surgical correction of the jaw, you have to hold your tongue on the roof of the mouth. For tongue, even in a new dimension of the airway, stay up and not gonna fall there as well. So for me, function defined form, not vice versa.
Got it. So do you think that you could do your intervention and avoid surgery potentially?
For a lot of people, I highly recommend that because surgery, at least that's what I learned from physical therapists. My knowledge are kind of collective knowledge from the people I work with, as well as, what I learned from my patients, of course,
Of course.
and from people who I invite on the interview. And surgery, it's a big impact on the body.
Yes, it really is.
Big impact. And you have to be totally ready for that impact. To take this impact, you have to be prepared.
Right.
So if it's important to you, and I know a lot of surgeons, wonderful surgeons who have a great result, I believe, your muscles have to be prepared before, and then they, get restored in the right way after.
I have to say that that is compelling to me, and I'll tell you why. I worked with this fitness person back in Seattle. I trained with her many, many times. We would do trades. I would cut her hair. She would help me work out. I would do this like high intensity program. But she had broken her back at some point, got a plate installed, and something about the plate went awry and she had to prep for surgery. So what she elected to do was a shredded program for 1 month prior to surgery where she worked herself, got in tip top shape, and was 150% dedicated to this shredding process. I saw her 2 weeks after significant back surgery. She had already healed and practically rejected the stitches because she healed so quickly and so efficiently. I was blown away at the regenerative power of, utilization of those muscles and getting them prepped for surgery. It was just such a compelling wound healing experience that has really stuck with me. But I could see that also being deployed in kind of transitioning to a possible necessary surgery and in getting prepped in all the functional ways so that everything is a success story.
Yes, yes. No, you're absolutely right. Like we have to think systemically, just like
Yeah.
you with your microbiome serum. You have to, to make it work. It's not from sickness to health. You have to maximize the health,
Yes.
and then surgery might be the answer.
Right. Well, I'm going to wrap up and say, my goodness, thank you so much for giving the really contextual experience of both your foray into sleep medicine, but also just giving us a really clear picture of what it looks like for that patient going through the process and all the ways they're going to restore their healthy functions, from balance to
Mhm.
mental clarity to being able to sleep with their loved ones without
Mm.
complaint or without restlessness. So thank you so much for coming to Let's Get Oral today.
Thank you very much. And again, if somebody very interested in or have a problem with the sleep apnea treatment, I would love you to join my community called Sleep Apnea Snoring Breathing Health, where I actually interview Camille, and we learn a lot about microbiome. And if you want to ask me questions about your treatment or help you to navigate this journey, please contact me again through the Facebook, Dr. Maria Sokolina, or through the group Sleep Apnea Snoring Breathing Health, or I'm on a LinkedIn. I always respond to my messages. Thank you very much. And as well as on Instagram, Dr. Maria Sokolina.
I'll put those links in the bio when we publish. So.
Thank you very much.
Please look for them. Yes, thank you. All right.
Let's